If you can't straighten your knee, you may be worried that you've sustained a serious knee injury. And there are some serious knee problems that can cause difficulty straightening your knee. But there are also some less serious problems. In this video, I'll unravel some of the most common causes, give you tips to help straighten your leg, and help you decide if you need to get further help. So first of all, if you've recently sustained an injury to your knee, a severe injury where it's swollen up or where you can't put weight on it, or where you feel like it might give out on you when you're walking, those are all signs that you should get help for it. And in fact, you should probably do that before trying the tips in this video. Now, if you've had a chronically stiff knee, maybe from arthritis, or you had a surgery several months ago, 3 months or more, and you're still having trouble straightening your leg, then these tips can probably help you out. Now, there are several different things that can cause difficulty straightening your knee. In the case of an acute injury, it may be swelling inside the knee capsule. It may be spasms if you've had an ACL tear and your hamstrings are trying to protect your knee. Or it may be a meniscus that's stuck inside the joint. And again, those are things you probably don't want to push past, things you probably don't want to treat on your own. You can also have stiffness of the capsule around your knee, and that can give you difficulty where you just can't get your knee to straighten. You may also have some muscle stiffness, particularly your calves and your hamstrings. Or it could be that your leg straightens if you push it, but you just can't straighten it under your own power. And I'll give you tips to help out with all of those problems in this video. But how do you know which of the problems it is? Well, most people initially think of hamstring stiffness when they can't straighten their knee. But the reality is, if you're having difficulty straightening your knee when you're standing up, it's probably not the hamstrings, or at least not exclusively the hamstrings. And that's because all of the muscles that cross your knee, across the back of the knee and prevent straightening, are two joint muscles. Your hamstrings cross both the knee and the hip, and your calves, or at least the gastrocnemius part of your calves, crosses the knee and the ankle. And so you can do different tests to tell which of the muscles are stiff, or if neither of the muscles are stiff and it's more to do with the joint itself. And to do that, you're going to lay down on your back and see if you can get your knee all the way flat up against the back of the table. Try and press it flat, or have someone else press it flat. And if you can't get it to lay all the way flat on the table or on a bed or on the ground, but preferably something hard, because a bed will kind of give a little bit. So preferably something hard, and try to get your knee all the way flat. Now, if you can't do it in this position, or somebody else can't push it flat when you're laying flat down on your back with your toes pointed out that way, that takes your calves out of it because your ankles are pointed down. It also takes your hamstrings out of it because your hips are straight. So if you can't flatten it out and somebody else can't flatten it out in this position, then it's a joint problem. And so it needs a joint solution. Now, if you can't flatten it in this position, but somebody else can, that's probably a muscle problem, because you have the mobility to get all the way straight. You just can't do it under your own power. And so that means you need to work on your quadriceps strength. Now, if you can get it all the way straight like this, then try pulling your toes up. And if that limits you from getting it all the way straight, or maybe it's a little bit bent and then it bends up more when you pull your toes up, that's a calf problem, because you've just stretched your calves across the ankle. And so they pull the knee a little bit more bent in order to get more range of motion. And then if you can straighten your knee like this, then try bringing your leg up this way and straightening your knee. And if the only position that you can't straighten your knee is when your hip is flexed, then that's more of a hamstring problem. But again, you're probably not going to notice that in your everyday life walking around, because largely we don't have our leg more flexed than this when we're walking around in everyday life. So let's start from the inside and then move out. If you have a joint problem, it's not going to matter how flexible the muscles are or how strong your muscles are, because you can't straighten the joint. And so To address the joint problem, we need a joint mobility solution. Now, to understand the solution, you have to sort of understand how the bones work in the knee when you're moving. As you straighten your knee, the tibia, your lower leg bone, glides forwards or anteriorly, and relatively, the femur glides posteriorly. So we need to improve the mobility of the tibia to glide forwards or the femur to glide backwards. It's much easier to glide the femur backwards in most cases. So to do this, we're going to take a towel and put it underneath your knee. You do need a hard or a firm surface for this. A standard bed that you have at home probably won't work. You do need either like a treatment table or to do it on the floor, or put a backing behind you where it won't give if you're sitting on a bed. Now you'll put the towel roll not directly under your knee, but under the calf just below the knee. This kind of blocks the tibia from gliding backwards, and then you can glide the femur backwards on it. The easiest way to do that is to turn your hand this way. If you have the mobility in your shoulder to do this, you want your forearm to point pretty much straight down. What this does is directs a force that way on your thigh bone or the femur, and it glides it backwards towards the table, while the towel puts the tibia forward. So the tibia is going forwards with the towel, and the femur is going backwards with your arm. And just do little oscillations here. This isn't a big movement like that. It's also important to note that you're not trying to arc it like this. When you do this type of arcing motion, that can pinch the meniscus or the fat pad, or if you have bone spurs inside the knee. That's not what you're trying to do, is a hinging motion like this. You want a direct glide where the tibia is going forwards and the femur is going backwards. And just oscillate like that. Now, because you're sitting up, your hamstrings are on tension here, so you may need a little thicker towel roll depending on how flexible your hamstrings are. But just oscillate back and forth, either like that or like that for about a minute. And then you'll lay back down after doing that and recheck and see if you can straighten your knee out anymore. So that's to improve the joint mobility. Next, we want to work on muscle flexibility. And largely, I think the best calf stretch is standing. But in this circumstance, it is kind of beneficial to stretch your calves sitting down, because you can also stretch your hamstrings at the same time, and you can visually see your quadricep muscle. So you can do kind of an active knee extension by doing what's called a quad set, where you try to contract your thigh muscles and push your knee flat down into the bed. And then you can pull the toes up this way and then lean back a little bit as much as the towel allows you to. That takes at least some of the tension off your hamstrings. If you're sitting up like this, that's going to put your hamstrings on a lot of stretch. The more you kind of lean back into it, it takes your hamstrings off stretch a little bit. So now you can pull up with the towel, pull your toes up towards you, which stretches the calf across the ankle as well as across the knee. And then at the same time, squeeze your quad muscle, contract, and try and use your own muscles to press your knee flat into the bed. And then once you do that, you want to try to hold this stretch, ideally for a minute if you can. If you need to take breaks, then split it up. Do 2 sets of 30 seconds, or 4 sets of 15 seconds, or 3 sets of 20 seconds, as long as you're getting a minute total stretch time in. So do that for a minute, and then we'll move on to the next exercise. Now, after you've improved the joint mobility in your knee joint, you've improved the muscle flexibility in your calves and then in your hamstrings. Now it's time to get your muscles activated. And one of the best ways to do that is doing that quad set that I mentioned before. Now, there are some advantages to doing it sitting. You can see the visual feedback of your thigh kind of changing contour. Your kneecap should also kind of move up towards you when you contract your quadricep muscle. This is particularly important after knee surgery, when your quadriceps may be inhibited. Again, if you have had a recent knee surgery, check with your surgeon and therapist before trying these tips. But activating your quadriceps by tightening the muscles here, you should see a change in contour in the muscles and then see your kneecap glide up towards you. But again, when you're in this sitting position, you may not be able to straighten your knee all the way if you have some stiffness in your hamstrings. So you can also do the quad set laying down here, where you can put your calves on slack, put your hamstrings on slack, and just focus on straightening the knee down all the way using your own power. Now from here, you can move on to another exercise known as the straight leg raise. And it's called that because you try to straighten your leg and then raise it up in the air. This is a very common post-surgical exercise, and there are a couple key points you want to keep in mind. You want to first do the quad set, get your knee as straight as you possibly can, and then you're thinking about lifting your heel off the table before your knee. So you want to actually try to hyperextend your knee here. That may or may not happen, but think about lifting the heel up before your knee, and then keep your knee locked out in full extension as you raise the leg up. Hold about 10 seconds and then lower down. Again, try to get the back of your knee to touch before the heel touches, or at least at the same time. So tighten the knee, lift the heel, lift the leg, hold 10 seconds, lower down, and try to get the back of the knee to touch before or at the same time as the heel. Now, once you've done this, it's time to move up to standing exercises. And ideally, standing exercises, weight-bearing exercises, are the best and most functional way to strengthen your knee, because we don't function in a sitting down or laying down position. Now, I'm not going to cover those in this video because I've got lots of other videos on how to strengthen your legs in a standing position in my knee pain relief playlist. Here's one of the videos up here and the playlist down there. But before you go, check those out. If you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.